Hi everyone! So today we're going to be talking about an education plan for asthma, which is a chronic condition that affects airways and your little lungs, resulting in inflammations from triggers like smoke, pets, dander, dust, those things. And this often causes the airway to tighten, swell, and produce extra mucus, making it difficult to breathe.
So some common symptoms include shortness of breath, wheezing, persistent cough, especially at night or early morning, and then chest tightness or discomfort.
Okay. So often you're prescribed an inhaler and a spacer. So I have a little picture here. And just to explain how it works, you're going to start by taking the cap off of the inhaler and the end of the spacer. You're going to want to shake the inhaler for about 5 seconds. You're going to put the inhaler's mouthpiece into the spacer end. Your child should be sitting or standing, and to start, you're going to have the child completely exhale, breathe all out as much as they can, and then open their mouth, and this mask piece is going to go over their mouth, and you're going to press down on the inhaler. Make sure that there's a tight seal around their mouth on the mask, and you're going to press down on the inhaler to give one puff, and then you're going to have your child breathe in as slowly and deeply as they can and try and hold their breath for about 10 seconds. And if you're supposed to prescribe 2 puffs, just wait about a minute in between. And that is how you use an inhaler and a spacer.
So there's different treatment plans depending on the severity of asthma that you have. And so daily maintenance is super important depending on your symptoms. And so you want to make sure that you're taking the correct meds that you're prescribed. This may include an inhaler like Kendall was just explaining, which is a corticosteroid. So this is going to open up your lungs and open up your airways to get the oxygen that your body needs. And then you're going to use the inhaler with the spacer properly. You're going to avoid allergens like we talked about before. And if you're going to exercise, we want to make sure that you're pre-treating your asthma and wait 15 minutes before exerting yourself. You want to make sure you have regular follow-ups with your doctor. So if you have mild asthma, you're going to want to visit your doctor every 6 months. If you have moderate to severe asthma, you're going to want to visit your doctor every 1 to 3 months. And also you want to make sure you review the medications regularly and adjust anything as needed with your doctor. You want to make sure you have a daily regimen and schedule just to keep track of all your medications, and so you can control your symptoms a little bit better. If you have a exacerbation, or if all of a sudden just randomly you're feeling tightness in your chest and not able to breathe, you want to grab your emergency inhaler, which is albuterol, and administer that to help you breathe a little bit better. And if your albuterol does not help, then go to the ER if your symptoms continue to progress. You want to monitor your symptoms, so every day keep a diary tracking your cough and wheezing, if you're waking up in the night because you can't breathe, as well as whenever you take your medications, document that. You also might want to do a peak flow monitor, and this just measures the lung capacity and shows if your asthma is getting worse. And then just continue to be aware of your symptoms and recognize if you're not controlling your asthma well.
Perfect. So just to kind of touch again on home monitoring and management. So, like we already said, you want to keep a diary of your symptoms just so you can track how things are going, and then that peak flow monitoring as well. And then having an emergency action plan if an asthma attack does occur. So being able to recognize those early signs if you're having an asthma attack, like it starting to become difficult to breathe, or you feel like you're breathing harder than you normally have to, and then following your medication prescription steps, seeking emergency services if your symptoms worsen despite using those medications, and that can look like your child not being able to breathe or form sentences. They might have blue tinge to their lips or fingernails, which can be a sign of cyanosis. No bueno. And also, if they're using their rescue inhaler, that albuterol inhaler, and it's just not working and they're still not able to catch their breath, then it's definitely time to go to the ER.
Okay, so now some nursing interventions that we came up with were assess respiratory rates and oxygen levels regularly, monitor for signs of worsening symptoms, educate on medication adherence and proper inhaler techniques, encourage avoidance of known triggers, and provide emotional support and reassurance.
And some lifestyle and environmental controls, which is where most people's asthma triggers come from. You're going to want to reduce your exposure to those allergens or irritants. So if you have a dog in the house, maybe we need to figure out a different type of dog, or if they're smoking, we really try and decrease that exposure. Make sure to have regular physical activity, but still use your inhaler before you go out and run around. Being able to have a healthy diet and hydration often helps. And also just telling your other family members about their asthma and how to manage, and if there's any emergencies on what to expect, and if needed, send them to the ER.
And then again, we just want to remind you to continue to schedule your regular checkups with your doctor, adjust treatment plans based on your needs and symptoms, and then stay up to date on all your vaccinations to prevent any respiratory infections. Thank you so much.
Thank you.